Hello and welcome. Welcome back to some of you. Today we are going to cover how medical technology prices are determined and negotiated. And this is part one of this conversation. My name is Franziska Möckel and I am a reimbursement and regulatory specialist for diagnostics within the Small Business Education and Entrepreneurial Development or SEED office. As part of the conversation on who purchases and pays for medical technology, we wanted to provide insights into how payers manage the price of medical technologies, as well as when and how price negotiations occur. In part two, we will cover what prices payers use and how they derive at them. If you've listened to the purchasers and payers of medical technology modules, this landscape should look familiar to you. I will not spend a lot of time on this ecosystem here. Rather, I want us to get anchored around the role of third-party payers, as they are the individuals and entities, I should say, that set the foundation for price negotiations. I also think this is a perfect time to introduce you to the three key elements of a good reimbursement strategy: coding, coverage, and payment. You know better than anyone that bringing a diagnostic or medical device or drug to market is a complex process. And that is why it is essential to understand the entire commercialization process and manage multiple tasks related to early stage research and development, clinical studies, regulations, reimbursement, and post-market surveillance, even at the same time. It is also essential to ensure reimbursement for the new medical device. And reimbursement is as important as obtaining regulatory approval. Specifically, we will focus on the element of payment today. So what does that entail? Well, it can entail the payment for the service itself. Also, very important, the value to the payer. And then we already talked about in prior modules about patients' out-of-pocket costs. So that can also be included in payment as an element of a great reimbursement strategy. Now, going back to our third-party payers, let's look at how they manage prices. There are a number of tools they use and can pull out of their toolbox, so to say, and we are going to step through them one by one. From a legal standpoint, it is the payer's fiduciary duty to ask, is this a procedure for a patient that meets a specific benefit category, such as Medicare, or eligibility category, such as for Medicaid, or status, such as for veteran or active military? In terms of contract conditions, one may ask, is this provider in the payer's network? Now here we are coming up to another reimbursement strategy element, coverage. Payers utilize coverage policies to determine if this procedure is medically necessary. This is generally speaking. An additional layer to using coverage policies to investigate if a procedure or medical device is medically necessary, we have utilization management. So here the payer would ask, is this procedure medically necessary for this patient at this time? Another question might be, are pre-certifications or prior authorizations needed for this particular procedure? Another reimbursement strategy element, coding, allows payers to investigate if a certain claim accurately reflects the services performed. Pulling it all together, payers, when reviewing a claim, consider all 5 factors when managing the prices for medical technology. Are all 5 factors met? Does the patient meet a specific benefit category, for instance? Was the provider who cared for the patient in network? Was the procedure and use of the medical device medically necessary? Was it appropriate for the patient at the time? And does the claim include the correct code for the service provided? Let's take another look at the medical device ecosystem and the interplay between medical technology manufacturers and vendors, between vendors and healthcare providers, and also healthcare providers and third-party payers. So we talked about how third-party payers manage prices and what kind of tools they can leverage. But how are prices even negotiated and when? It actually all starts when your medical technology hits the market. You have to consider current market leaders and low price leaders when you set your own price. And in essence, you compete for market share the moment you bring your product to market, potentially even before that. Now, hospitals, in order to take advantage of bulk purchase discounts, they have contracts with preferred vendors or distributors. So you should consider if your medical technology will be offered by all, some, or just one vendor, and what market share each vendor has. Now let's talk about healthcare providers or hospitals. Third-party payers actually have preferred hospitals and healthcare providers in their network, and that is where the term in-network derives from. So will your medical device be used by a provider that is considered a network and for the patients they serve? And let's not forget employers who partner with preferred insurers. So to tie a nice little bow around this topic, you should consider for the new technology you're bringing to market the following questions. How will the price of your medical technology be impacted by players that are already on the market? Are there certain distributors I should work with in order to get to economies of scale? So distributing my medtech to health systems. How will the location of the healthcare system I am serving and their contracts with insurers impact commercialization? And lastly, could specific payers have an impact on my pricing strategy? This wraps up part one of how prices are negotiated and determined, and hopefully you'll tune in for part two. In this section, we covered price management tools third-party payers use that include legal contract conditions, coverage policy, utilization management, and coding. And we also talked about factors that impact pricing. And this includes products that are already on the market, contracts healthcare systems have with preferred vendors, and whether a healthcare provider is considered a network. It also includes employers' preferred insurers. So again, hopefully you'll tune in to part two of how prices are determined and negotiated for medical technology. And if you still have questions after listening to this recording, you can always reach out to us and request a consult with someone from our team.